Today, we're going to talk about something that might surprise you. There are certain medical tests that, while well-intentioned, may not always be the best choice for adults over 70. Now, before we go any further, I want to be very clear about something important. This isn't about avoiding necessary medical care or ignoring symptoms that concern you. This is about making informed decisions with your healthcare provider about which tests truly benefit you at this stage of life. The reality is that as we age, our bodies change, and what made sense for screening and testing in our 50s and 60s may not always make sense in our 70s and beyond. Research from medical journals shows that some routine tests can sometimes lead to procedures or treatments that don't actually improve quality of life for older adults, and in some cases may cause unnecessary stress or complications. Many of us have experienced this personally or know someone who has, getting a test result that led to worry, additional procedures, or treatments that ultimately didn't help. The good news is that we can have thoughtful conversations with our doctors about which tests are truly necessary for our individual situations. Today, I'll walk you through 5 common medical tests that healthcare experts suggest we might want to discuss more carefully with our doctors. For each one, we'll explore why these tests are commonly ordered, what the potential concerns are for those of us over 70, and what alternatives might be better choices. Before we get started, I'd love to know where you're joining me from today. Drop a comment below and feel free to ask any questions you have about today's topic. And don't forget to hit that subscribe button and turn on notifications so you never miss a health-boosting tip. We're building a wonderful community of health-conscious individuals who are learning to navigate their golden years with wisdom and confidence. Let's start with our 5th item on the list. Number 5. Bone density scans, the well-meaning test that may cause more worry than help. Let's talk about bone density scans, also called DEXA scans. These tests measure how strong your bones are and are commonly used to screen for osteoporosis. On the surface, this seems like a smart idea. Who wouldn't want to know about their bone health? How exactly does a DEXA scan work? You lie on a table while a machine passes over your body, measuring bone density in your hip and spine. It's painless, quick, and doesn't require any needles or uncomfortable procedures. The results give you a T-score that compares your bone density to that of a healthy 30-year-old. Here's where things get complicated for those of us over 70. Research published in the Journal of the American Geriatric Society shows that these scans often reveal what doctors call osteopenia, slightly reduced bone density that doesn't quite reach the level of osteoporosis. But here's the important part. This bone density reduction is a normal part of aging, much like getting gray hair or developing wrinkles. The concern is what happens next. Many doctors, wanting to be proactive, prescribe medications called bisphosphonates to strengthen bones. These medications include drugs like alendronate, which you might know by brand names like Fosamax. While these medications can help some people, they also come with potential side effects that can significantly impact quality of life. Some patients experience severe heartburn or esophageal irritation from these medications. Others develop jaw problems, including a rare but serious condition where the jawbone deteriorates. There have also been reports of unusual fractures in people taking these drugs long-term. Let me share Rose's story with you. Rose was a vibrant 76-year-old retired piano teacher who loved her daily walks and had never experienced a fall or fracture. During her annual checkup, her doctor recommended a DEXA scan just to be safe. The results showed osteopenia, not full osteoporosis, but reduced bone density. Her doctor immediately prescribed alendronate to prevent future fractures. Within 3 months, Rose was experiencing severe acid reflux that kept her awake at night. She also developed jaw pain that made it difficult to eat her favorite foods. Most heartbreaking of all, the joint stiffness and discomfort made it painful for her to play piano, something that had brought her joy for decades. When Rose came to see us, we took a different approach. We stopped the medication and focused on natural bone health strategies. We ensured she was getting adequate vitamin D, something many of us over 70 are deficient in. We introduced gentle resistance exercises using bands, which research shows can be more effective than medications for preventing fractures in healthy older adults. We also looked at her diet, making sure she was getting calcium from food sources like leafy greens, sardines, and yogurt. These foods provide calcium in a form that's easier for our bodies to use than supplements. A year later, Rose was back to playing piano regularly. Her balance had actually improved from the resistance exercises, and she felt stronger and more confident than she had in years. Most importantly, she had no fractures. Research from Osteoporosis International found that lifestyle interventions, including strength training, balance exercises, adequate nutrition, and vitamin D optimization, can reduce fracture risk by more than 20% in healthy older adults. That's often better than what medications achieve, without the side effects. The key question to ask your doctor is this: given my overall health, my history of falls, and my bone health, what's my actual risk of fracture, and will this medication meaningfully reduce that risk? For many healthy adults over 70 who aren't experiencing falls or previous fractures, the answer might surprise you. If you haven't had falls, if you're staying active, and if you're eating well, a DEXA scan might not be necessary. Instead, focusing on the lifestyle factors that actually prevent fractures, staying active, maintaining good balance, ensuring adequate nutrition, might be a better use of your time and energy. Remember, preventing fractures isn't just about bone density. It's about staying strong, maintaining good balance, and keeping your muscles healthy. These are things you can work on every day, regardless of what a scan might show. Number 4. Brain MRI for memory concerns. When technology finds problems that aren't really problems. Let's explore brain MRIs for memory concerns. If you've noticed that you occasionally forget where you put your keys, or if you sometimes struggle to remember a neighbor's name, you might have considered asking your doctor about getting a brain scan to check for dementia or Alzheimer's disease. This concern is completely understandable. Memory changes can be frightening, and many of us worry about cognitive decline as we age. Brain MRIs provide incredibly detailed pictures of brain structure, and it seems logical that they would help diagnose memory problems. However, the reality is more complex than we might expect. Research shows that for mild memory concerns, the kind most of us experience as a normal part of aging, brain MRIs often create more problems than they solve. Here's what typically happens. The MRI reveals what radiologists call age-related changes. Things like mild brain shrinkage or small white spots called white matter hyperintensities. These findings are incredibly common in healthy older adults and are usually part of normal aging, much like developing wrinkles or gray hair. A study published in Neurology Today examined over 3,000 MRI scans of adults aged 70 to 85 who had mild memory complaints. The results were eye-opening. 86% of these scans showed some type of abnormality. However, only 3% of these findings represented something that could actually be treated. This means that the vast majority of people, 83%, received worrying news about abnormalities in their brains when nothing was actually wrong. Imagine the anxiety and stress this creates. Many people assume these findings mean they're developing dementia, when in reality they're simply showing normal age-related changes. Even more concerning, nearly 12% of patients in this study underwent additional invasive procedures, including spinal taps and brain biopsies, because of unclear MRI findings. These procedures carry real risks and often don't provide useful information. Let me tell you about George, a 74-year-old retired engineer who came to see us worried about his memory. He was still sharp and engaged, but he occasionally misplaced his keys and sometimes forgot people's names at social gatherings. His previous doctor had ordered a brain MRI to rule out dementia. The MRI showed white matter changes, and George was told he had evidence of small vessel disease. He was referred to a neurologist and told to prepare for possible cognitive decline. George became so anxious that he stopped driving, quit his volunteer work at the library, and became increasingly isolated and depressed. When we evaluated George using standardized cognitive tests, his performance was completely normal for his age. We explained that white matter changes are found in up to 90% of healthy adults over 70 and don't predict dementia or cognitive decline. We worked with George on strategies to support his memory and overall brain health. We optimized his sleep, since poor sleep significantly affects memory consolidation. We ensured he was well hydrated, as even mild dehydration can impact cognitive function. We encouraged social engagement and mental stimulation through his volunteer work. We also reviewed his medications. Since some common drugs, including certain blood pressure medications, sleep aids, and anxiety medications, can affect memory and concentration, after making these adjustments, George's memory concerns improved significantly, and more importantly, his confidence and quality of life returned. Research consistently shows that for mild memory concerns, the most effective first step is a comprehensive cognitive assessment, a paper and pencil test that evaluates memory, attention, and problem-solving skills. These tests are quick, inexpensive, and don't carry the risk of creating anxiety over normal age-related findings. Good cognitive health depends much more on lifestyle factors than on what an MRI might show. Regular physical exercise, particularly activities that challenge balance and coordination, has been shown to improve memory and cognitive function. Social engagement, learning new skills, and maintaining good sleep habits all support brain health more effectively than medical interventions for mild memory concerns. The question to ask your doctor is, do my memory concerns warrant an MRI? Or would a cognitive assessment and focus on brain-healthy lifestyle habits be a better first step? Unless you're experiencing severe memory loss, significant personality changes, or other neurological symptoms like seizures, the cognitive assessment is usually the wiser choice. Remember, normal aging does involve some changes in processing speed and occasional forgetfulness. These changes don't necessarily indicate disease, and an MRI won't change the most important things you can do to maintain cognitive health: staying physically active, socially engaged, mentally stimulated, and well-rested. Number 3. Cardiac stress tests. When heart testing may stress more than your heart. Let's talk about cardiac stress tests. These tests are commonly recommended for seniors who mention feeling a bit more tired than usual, experiencing occasional chest tightness, or just not feeling quite as energetic as they used to. The stress test involves either walking on a treadmill or receiving medication that makes your heart work harder, while doctors monitor how your heart responds. The goal is to identify blocked arteries before they cause a heart attack. This sounds like excellent preventive care, and for some people it absolutely is. However, for many healthy adults over 70 who don't have clear symptoms of heart disease, stress tests can sometimes lead to a cascade of procedures that don't actually improve health outcomes. Here's the challenge. As we age, stress tests become less accurate. Research indicates that among adults over 70, false positive results, where the test suggests a problem that doesn't actually exist, occur in up to 40% of cases. This means that 4 out of 10 people might be told they have heart problems when their hearts are actually fine. What happens after a false positive result can be problematic. Often patients are referred for additional testing, including cardiac catheterization, a procedure where a thin tube is threaded through blood vessels to directly examine the heart's arteries. While this procedure is generally safe, it does carry risks, including bleeding, kidney problems from contrast dye, and in rare cases, stroke or heart attack. A significant study published in JAMA Cardiology found that more than 50% of stents placed following stress test referrals were unnecessary, meaning they were placed in people who didn't have symptoms that would benefit from the procedure. These patients showed no improvement in survival rates or quality of life compared to those who received medical management alone. Let me share Raymond's experience. Raymond was a 75-year-old retired postal worker who stayed active with daily walks around his neighborhood. During a routine checkup, he mentioned feeling slightly more tired when walking up hills than he used to. His doctor recommended a stress test just to be safe. The test results were inconclusive, showing some changes that could suggest heart problems. This led to a cardiac catheterization procedure, where doctors found mild narrowing in one artery. A stent was placed to open the narrowing. That evening, Raymond had an allergic reaction to the contrast dye used during the procedure. His kidneys were affected, requiring a 6-day hospital stay and weeks of follow-up care. The fatigue he'd originally mentioned didn't improve because it had never been related to his heart in the first place. He was simply dehydrated and needed better pacing during his walks. Research from the American Heart Association shows that for people over 70 without typical cardiac symptoms, such as chest pain during activity, significant shortness of breath with exertion, or dramatic changes in exercise tolerance, stress tests often don't provide meaningful benefits and may lead to unnecessary procedures. So what are typical cardiac symptoms that would warrant a stress test? chest pain, or pressure that occurs specifically during physical activity and goes away with rest is a classic sign. Significant shortness of breath that's new and occurs with minimal exertion is another important symptom. Feeling dizzy or lightheaded during activity, especially if it's a new symptom, should also be evaluated. However, general fatigue, feeling slowed down, or needing more rest breaks during activities are often normal parts of aging and don't necessarily indicate heart disease. These symptoms can be related to dehydration, poor sleep, medication side effects, or simply the normal changes that come with getting older. For people over 70 without clear cardiac symptoms, there are safer alternatives to stress testing. A resting electrocardiogram (EKG) can identify heart rhythm problems and some structural issues without any stress on the heart. This simple test takes just a few minutes and carries no risks. Another option is a coronary calcium scan, which uses a small amount of radiation to look for calcium deposits in heart arteries. This test can identify people who might benefit from more intensive monitoring or lifestyle changes without the risks associated with stress testing. The most important question to ask your doctor is, what specific symptoms am I having that suggest I need a stress test? And what would we do differently based on the results? If you don't have classic cardiac symptoms, if you're able to do your normal daily activities without significant limitations, and if you don't have a strong family history of early heart disease, a stress test might not be necessary. Instead, focusing on heart-healthy lifestyle habits often provides more benefit than testing. Regular physical activity appropriate for your fitness level, a diet rich in fruits and vegetables, adequate sleep, stress management, and staying hydrated all support heart health more effectively than finding and treating minor blockages that aren't causing symptoms. Remember, the goal isn't to avoid all medical care, but rather to ensure that the tests we undergo are likely to lead to treatments that will actually improve our health and quality of life. For many healthy adults over 70, maintaining good lifestyle habits and having regular checkups with a trusted doctor provide better heart protection than stress testing. Number 2. Colonoscopy screening, when the cure might be riskier than the disease. Let's discuss colonoscopy screening, which might surprise you as being on this list. Colonoscopy involves using a flexible camera to examine the inside of the colon to look for polyps or signs of cancer. For younger adults, this screening has proven very effective at preventing colon cancer deaths. However, the picture becomes more complex for adults over 70, and particularly for those over 75. The U.S. Preventive Services Task Force, which provides evidence-based recommendations for medical screening, currently recommends that routine colon cancer screening should generally stop at age 75 for most people. Why this change in recommendation? As we age, the balance between benefits and risks shifts. The preparation for colonoscopy becomes more challenging and potentially dangerous for older adults. The strong laxatives used to clear the bowel can cause significant dehydration, dangerous electrolyte imbalances, and kidney problems, especially in people who take certain medications or have underlying health conditions. The sedation used during the procedure also poses increased risks for older adults. Research shows that seniors are more likely to experience cognitive changes, breathing problems, or heart rhythm disturbances from sedation. The procedure itself carries risks of bleeding, perforation of the bowel, and complications that may require emergency surgery. A comprehensive study published in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older who underwent colonoscopy. The findings were sobering. For every 1,000 colonoscopies performed on patients 75 and older, only 2 to 3 lives were saved from colon cancer, while more than 20 people experienced serious complications that required hospitalization or additional procedures. This 10-to-1 ratio of harm versus benefit is particularly concerning when we consider that many polyps found in older adults grow very slowly. By the time these polyps might become cancerous, many seniors will have passed away from other causes related to normal aging. Let me tell you about Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in bowel habits, no abdominal pain, and no family history of colon cancer. She had previously had 2 colonoscopies that were completely normal, with the most recent one 5 years earlier. Her new primary care doctor recommended another colonoscopy as part of routine screening. Dana agreed, trusting her doctor's recommendation. During the procedure, a small polyp was removed. Everything seemed to go well initially, and Dana went home the same day. That night, she developed severe abdominal pain and became dizzy. At the emergency room, doctors discovered that the colonoscopy had caused a small tear in her bowel, a complication called perforation. She required emergency surgery, spent 9 days in the hospital, lost 15 pounds, and developed complications that affected her energy and strength for months. The polyp that was removed turned out to be completely benign and very slow growing. Given Dana's age and the polyp's characteristics, it would likely never have caused problems in her lifetime. The procedure intended to protect her health actually caused significant harm. This doesn't mean that all colonoscopies are inappropriate for people over 70. If you're experiencing symptoms like blood in your stool, significant changes in bowel habits, unexplained weight loss, or abdominal pain, colonoscopy might be an important diagnostic tool. If you have a strong family history of colon cancer or have had previous concerning findings, continued screening might be beneficial. However, for healthy adults over 75 with no symptoms and no significant risk factors, alternative screening methods might be safer and more appropriate. Stool-based tests, such as the FIT test, fecal immunochemical test, can be done at home without any preparation or sedation. These tests effectively identify most cases of colon cancer that need immediate attention. The FIT test looks for hidden blood in stool samples, which can be an early sign of colon cancer. While it's not as comprehensive as colonoscopy, research shows it catches the vast majority of cancers that are large enough to be causing symptoms or are likely to cause problems in the near future. Another option is the stool DNA test, which looks for genetic changes that might indicate cancer or precancerous conditions. Like the FIT test, this can be done at home and doesn't require the risks associated with colonoscopy preparation and sedation. The key questions to ask your doctor are, given my age, overall health, and previous screening history, what's my actual risk of developing colon cancer that would significantly impact my life? Are there safer screening options that would catch concerning changes without the risks of colonoscopy? If you're over 75, if you've had previous normal colonoscopies, if you have limited life expectancy due to other health conditions, or if you're at high risk for complications from sedation, a stool-based test might be a much wiser choice. It's also worth noting that many of the factors that reduce colon cancer risk are within our control regardless of screening. Staying physically active, maintaining a healthy diet rich in fiber from fruits and vegetables, limiting processed meats, not smoking, and maintaining a healthy weight all significantly reduce colon cancer risk. Remember, the goal of screening is to find problems early when they can be treated effectively. For many adults over 75, the cancers that colonoscopy might find are often slow-growing and unlikely to cause significant problems within their remaining lifespan. In these cases, the risks of screening may outweigh the benefits. This is definitely a conversation to have with your doctor. Taking into account your individual health status, your previous screening history, and your personal preferences about medical interventions. Number 1. Full-body CT scans. The radiation risk that may outweigh the benefits. Now we come to our number 1 concern, full-body CT scans. These comprehensive scans are often marketed as the ultimate in preventive healthcare, promising to detect cancer and other serious diseases before symptoms appear. They're frequently included in executive health packages or offered by private clinics as premium screening services. The marketing around these scans can be very appealing. Who wouldn't want a comprehensive look at their entire body to catch problems early? The promise of peace of mind and early detection saves lives resonates with many of us who want to take charge of our health. However, the reality of full-body CT scanning is more complex and concerning than the marketing suggests, particularly for adults over 70. These scans expose your body to significant amounts of ionizing radiation, the same type of radiation that can cause cancer. Each full-body CT scan delivers a radiation dose equivalent to about 500 chest X-rays. Here's the sobering reality. Research published in JAMA Internal Medicine indicates that the increasing use of CT scans in the United States may be responsible for up to 5% of all cancer cases. That means that approximately 1 in every 20 cancers might be caused by medical radiation from scans intended to detect cancer. This puts CT scanning on par with alcohol consumption as a cancer risk factor. This is particularly concerning for older adults, whose bodies are less efficient at repairing radiation damage. While younger people's cells can often repair minor radiation damage, this repair mechanism becomes less effective as we age, making seniors more vulnerable to radiation-induced cancers. But the radiation risk is only part of the problem. Full-body CT scans have an extremely high rate of finding incidental findings, abnormalities that look concerning on the scan but turn out to be completely harmless. These might include small nodules in the lungs, cysts in the kidneys, or calcifications in various organs that are simply part of normal aging. Once these findings appear on a scan, they trigger what doctors call a cascade of care, a series of follow-up tests, additional scans, and often invasive procedures like biopsies. Each step in this cascade carries its own risks and costs, both financial and emotional. Let me share Marcus's story. Marcus was an energetic 80-year-old who taught martial arts to other seniors at his community center. He felt great and decided to treat himself to a comprehensive executive physical at a high-end private clinic for his birthday. The package included a full-body CT scan. The scan revealed a small lung nodule measuring just 3 millimeters, about the size of a pinhead. While his doctor mentioned it was probably nothing to worry about, Marcus was referred to an oncologist just to be safe. The oncologist recommended a PET scan to get a better look at the nodule. The PET scan showed some activity around the nodule, which could indicate cancer or inflammation. This led to a needle biopsy, where a long needle was inserted through Marcus's chest wall to obtain a tissue sample from the tiny nodule. The biopsy showed that the nodule was completely benign, just scar tissue from an old infection that Marcus never even knew he had. However, the biopsy procedure caused his lung to collapse, a complication called pneumothorax. Marcus spent a week in the hospital with a chest tube, followed by 2 months of recovery during which he couldn't teach his martial arts classes or maintain his usual active lifestyle. All of this medical intervention, expense, pain, and worry was for a finding that would never have caused any problems if it had been left alone. Marcus's story illustrates why major medical organizations, including the American College of Radiology, have taken clear positions against routine full-body CT screening in healthy adults. The evidence simply doesn't support the use of full-body CT scans for screening in people without symptoms. Multiple large studies have failed to show that these scans save lives or improve health outcomes. Instead, they consistently show increased rates of unnecessary procedures, patient anxiety, and radiation exposure. This doesn't mean that CT scans are never appropriate. If you have specific symptoms that concern your doctor, such as unexplained weight loss, persistent cough with blood, or unusual lumps or swelling, targeted CT scanning of the specific area of concern can be an excellent diagnostic tool. The key difference is using CT scans to investigate specific problems, rather than scanning healthy people hoping to find hidden diseases. The challenge is that full-body CT scans are very good at finding things. They're just not good at distinguishing between findings that matter and findings that don't. As one radiologist explained it, the more carefully you look, the more abnormalities you'll find, but most of them aren't actually problems. For seniors especially, many of the abnormalities found on full-body CT scans are simply evidence of a life well lived. Small scars from infections we fought off decades ago, benign cysts that have been stable for years, and calcifications in arteries that reflect normal aging all show up on these scans as findings that may require follow-up. A much more effective approach to health maintenance involves paying attention to your body's signals and maintaining regular relationships with healthcare providers who know you well. Symptoms like unexplained weight loss, persistent fatigue that's different from your normal patterns, new lumps or bumps, or changes in bowel or bladder habits are much better indicators of when medical investigation is needed. Preventing disease remains important, but the most effective prevention comes from lifestyle choices rather than scanning. Staying physically active in ways that you enjoy, eating a diet rich in fruits and vegetables, maintaining social connections, getting adequate sleep, and managing stress all have proven benefits that far exceed what any scanning can provide. The question to ask yourself and your doctor is, am I considering this scan because I have specific symptoms or concerns, or am I hoping it will provide reassurance about my health? If it's the latter, you're likely to be disappointed and may be exposed to unnecessary risks. Remember, true peace of mind comes from taking good care of yourself through healthy lifestyle choices and maintaining good relationships with healthcare providers who know you and your health history. It doesn't come from scanning technology that often creates more questions than answers. Practical implementation section. Putting it all together, having thoughtful conversations about medical testing. Now that we've discussed these 5 tests, let's talk about how to apply this information in your own healthcare decisions. The goal isn't to avoid all medical testing, but rather to ensure that the tests you undergo are likely to provide information that will actually improve your health and quality of life. Creating a framework for medical decisions. When your doctor recommends any test or procedure, here are the key questions to ask. First, what specific symptoms or risk factors am I experiencing that suggest this test is needed? Good reasons for testing include new symptoms, significant changes in your health, or strong family histories of specific diseases. Be wary of tests that are recommended simply because of your age or as part of a routine package. Second, what would we do differently based on the results of this test? If the answer is unclear, or if the potential treatments wouldn't significantly improve your quality of life, the test might not be necessary. The goal of testing should be to guide treatments that will help you feel better or live better. Third, what are the potential risks and complications of this test? And how do they compare to the potential benefits for someone my age? Every medical intervention carries some risk, and these risks often increase with age. Make sure you understand both sides of the equation. Working with your healthcare team. The best medical decisions are made collaboratively between you and healthcare providers who know you well. If you're working with a new doctor who immediately recommends multiple tests, it's reasonable to ask for time to consider your options and perhaps seek a second opinion. Remember that you have the right to decline any test or procedure. You're not being difficult or non-compliant by asking questions or wanting to understand the reasoning behind recommendations. Good doctors welcome these conversations and will take time to explain their thinking. Focusing on what really matters for healthy aging. While we're thinking critically about medical testing, let's not forget the proven strategies for healthy aging that don't require any medical intervention at all. Staying physically active in ways you enjoy provides more health benefits than most medical tests or treatments. This doesn't mean you need to run marathons. Gentle walking, swimming, tai chi, or even dancing all provide significant benefits for bone health, heart health, brain function, and overall well-being. Maintaining social connections and staying engaged with activities you find meaningful has profound effects on both physical and mental health. Research consistently shows that people with strong social networks live longer and have better health outcomes than those who are isolated. Good nutrition becomes increasingly important as we age, but it doesn't need to be complicated. Focus on eating plenty of fruits and vegetables, getting adequate protein to maintain muscle mass, and staying well hydrated. These simple steps provide more health benefits than most supplements or medications. Quality sleep is crucial for memory, immune function, and overall health. If you're having trouble sleeping, addressing this through good sleep habits, room environment, and discussions with your doctor about medications that might interfere with sleep is often more beneficial than extensive testing. Special considerations for different life situations. Your approach to medical testing might vary depending on your overall health status and life situation. If you have multiple chronic conditions that significantly limit your life expectancy, aggressive screening for additional problems may not be helpful and could actually detract from your quality of life. If you're dealing with significant cognitive changes, mobility limitations, or other health challenges, the focus should be on managing these known issues rather than looking for new problems through extensive testing. Conversely, if you're in excellent health with a strong family history of longevity, you might choose to be more proactive about certain types of screening, always weighing the potential benefits against the risks for your specific situation. Creating your personal healthcare philosophy. Take some time to think about your own healthcare goals and preferences. Do you prefer to know about every possible health issue, even if treatments wouldn't significantly help? Or would you rather focus on maintaining quality of life and addressing only problems that are causing symptoms? There's no right or wrong answer to these questions, but having clarity about your own preferences will help you make decisions that align with your values and goals for your remaining years. Remember, the goal of healthcare should be to help you live as well as possible for as long as possible. Sometimes that means doing tests and treatments, and sometimes it means choosing not to do them. The key is making informed decisions that serve your individual needs and preferences. Your health journey, wisdom, choices, and quality of life. As we wrap up today's discussion, I want to emphasize that this information isn't about rejecting modern medicine or avoiding all medical care. It's about approaching healthcare decisions with wisdom and understanding, particularly as we navigate our later years. The 5 tests we've discussed today, bone density scans, brain MRIs for memory concerns, cardiac stress tests, colonoscopies, and full-body CT scans, all have their place in medicine. The key is understanding when they're truly beneficial and when they might cause more harm than good. Each of you watching today has a unique health situation, family history, and set of personal values that should guide your healthcare decisions. What's right for one person may not be right for another, and that's perfectly okay. The most important takeaway from today's discussion is that you have the right and responsibility to be an active participant in your healthcare decisions. Don't hesitate to ask questions, seek second opinions when you're unsure, and advocate for approaches that align with your goals and values. If you found this information helpful, I'd love to hear about your experiences with medical testing. Have you ever had a test that led to unnecessary worry or procedures? Or perhaps you've had a positive experience where thoughtful testing made a real difference in your health. Drop a comment below and share your story. Your experience might help others who are facing similar decisions. Don't forget to hit that subscribe button if you haven't already, because next week we're going to talk about the most important health screenings that seniors should prioritize, the tests that actually do make a significant difference in health outcomes and quality of life. If you know someone who might benefit from this information, perhaps a friend who's been feeling pressured to undergo extensive testing, or a family member who's struggling with healthcare decisions, please share this video with them. Remember, while the information we've discussed today is based on current medical research and guidelines, it's not meant to replace personalized medical advice. Always consult with your healthcare provider before making decisions about your medical care, especially if you have existing health conditions or specific symptoms that concern you. Your health and well-being are precious, and the decisions you make about medical testing should support your goals for living well and enjoying your golden years. Sometimes the best medical care is the most thoughtful care that considers not just what can be done, but what should be done for your individual situation. Thank you for joining me today, and I look forward to continuing this important conversation about healthy aging in our next video. Take care of yourselves, and remember, you have more control over your health and healthcare decisions than you might think.